Hi, everyone. Thanks so much for attending Crash, Boom, Bang, Addressing Noise Aversion in Dogs, sponsored by our friends at Zoetis. I'm Christy Keith, Senior Communications Strategist for Fear Free. And before we get started, I'd like to introduce our presenters. Dr. Kenneth Martin is one of only 86 veterinarians in the world to obtain the status of a diplomate of the American College of Veterinary Behaviorists. He is also an avid dog trainer who gives me an inferiority complex because he began training dogs for AKC obedience and conformation when he was 8 years old. He also assisted with the training of search and rescue dogs in the New Orleans area and serves as a subject matter expert for Fear Free. Debbie Martin continues to give me an inferiority complex because she is among only 16 veterinary technicians to have achieved the status of a veterinary technician specialist in behavior. He is also an avid trainer and teacher. Debbie worked as faculty for the Karen Pryor Academy Dog Trainer Professional Program from 2010 to 2016 and has taught multiple workshops in Texas and worldwide. She is also a member of the Fear Free Executive Council. Dr. Martin, please take it away.
Thank you. Welcome everyone to the Crash Boom Bang webinar. We're going to talk about addressing noise aversions in dogs. Okay, so we're going to begin talking about the prevalence of noise aversions. You'll find that they're pretty common problems. I'm going to talk about prevention, so what's been out there, what we potentially could consider doing for preventing noise aversions in dogs, and then we'll really focus on treatment options. So Debbie's going to go through behavioral modification, environmental modification, and then I'm going to talk about use of medication for treating these types of conditions. So a noise aversion. Sometimes a noise aversion may be an anxiety, sometimes it may be a phobia. Essentially, a noise aversion essentially is a fear of noises. But there can be times where the animal shows anxiety anticipating the noise events about to happen, or essentially a phobic reaction, which is an exaggerated response to fear. So essentially, we could define a noise aversion, an anxiety, or a phobia as an exaggerated, non-gradient response to noises with active avoidance, escape, and or anxiety, and with activation of the sympathetic nervous system. Typically, these dogs are going to have an exaggerated or a delayed recovery period that we see. So we know it ends up being an abnormal problem, not just a normal problem with recovery. And so the behavior can occur with the actual presentation of the stimulus. The animal hears the noise, or the behavior can occur with anticipation of the stimulus. The animal anticipates the noise is about to happen. You actually will find that fear and anxiety disorders are quite common in dogs. Fear and anxiety disorders affect an estimated 23 million dogs in the United States. So it's a pretty common problem. And a study conducted by Zoetis found that 2/3 of dog owners, 67%, said their dogs experienced noise aversion symptoms when exposed to loud noises. So it's a pretty common problem. Typically, dogs are going to show signs of fear, anxiety, and stress. And some of those signs, at least in the study that was conducted by Zoetis, the most common presenting clinical sign was going to be excessive whining, whimpering, or barking, followed by trembling or shaking, followed by hiding. So dogs that bark, when they hear a sound or a noise or an event, they're alerting to it. They usually are somewhat worried about it. They're anxious about it in that context. But we can also see other behaviors associated with the fear, the anxiety, and stress. Sometimes you can see destructive behavior, that the animal tries to jump out of the window or escape from the home or break out of a confinement area when they hear these sounds, where they hear these noises. You may see excessive salivation. So the animal's drooling profusely, panting profusely. You may also see inappropriate elimination, where the animal is afraid to go outside, and so they show inappropriate toileting behavior in the house too as well. So you can see a multitude of clinical signs associated with fear, anxiety, and stress, and really the onset is associated with specific noises or noise aversions. So let's look at a video example. This is an example of Zip actually during storms. He had a fear of thunder. So you can see poor Zip, he's panting, his pupils are dilated even though he has dark eyes, it's kind of hard to see. His ears are pinned back, he's kind of hunching over, his tail's tucked, so he's showing signs of fear. inability to settle, can't find a place to get comfortable. Here I'll go over in the corner, kind of looking for a place to hide. So those would be typical clinical signs that you can see with noise aversions in dogs. So there was a survey that was conducted in Norway. It was actually a pretty large survey. The sample size was over 5,000 dogs. And they looked at noise sensitivity in 17 breeds. They looked at the prevalence, the breed risk, and correlation with other fears in other situations or context. In that study, they found that 23% of dogs were fearful of noises. Females were 30% more likely to be fearful than males. Neutered were 72% more likely to be fearful than sexually intact dogs. And dogs that had noise sensitivity were 3 times more likely to have separation anxiety. They were 18 times more likely to be fearful in novel situations and 4 times more likely to take longer to calm down after a stressful situation. So you have that exaggerated recovery period where it's abnormal. It's not just so they hear a loud clap of thunder and they startle and they readily recover from that, which, you know, as a human, you might startle if there was a loud clap of thunder. But there's an exaggerated recovery period and they become fearful in the situations where they heard the noises. That's quite common too as well. Physiological responses with fear, anxiety, and stress may be adaptive in the short-term response. So there is an adrenaline surge or an epinephrine surge, and that actually is a survival strategy. So it will elicit fight, flight, freeze, fret, or fidget. The animal tries to get away, tries to avoid that context, avoid that situation, tries to keep the animal safe. And there's physiological responses associated with adrenaline. One is increased heart rate, increased respiratory rate. There will be pupil dilation, piloerection. It readies the body's glucose metabolism for fight or flight. And there's an increase in vigilance or scanning. There's essentially a heightened arousal response that's seen with adrenaline. But the chronic response to fear, anxiety, and stress is really maladaptive with cortisol. It can lower the immune system, and it can make the animal susceptible to underlying GI conditions. So chronic stress, chronic anxiety can affect the immune system, can affect the GI system, and lead to GI sensitivities. So let's look at a case example. So this was a dog named Tulip, the 7-year-old female spayed basset hound. And the initial behavioral consultation of Tulip was in July. She had a history of hemorrhagic gastroenteritis that required hospitalization several times a year for the past 2 years. And these incidents were always worse in the summer. Well, when we did the behavior consult, we gave a diagnosis of separation anxiety. We gave a diagnosis of thunderstorm phobia, agoraphobia, submissive urination, and house soiling. So these are common problems that are interrelated. The behavior started with thunderstorms. Why? Thunderstorms are more prevalent in the summer, in the spring. So that was the primary clinical symptom, the fear of thunder that happened. And with that, this dog developed separation anxiety, which we'll see are common comorbid conditions. So because those noise events were associated with going outside, the dog did not want to go outside to use the bathroom. The dog would use the bathroom in the house. The dog didn't want to leave the owners to go outside because it wasn't comfortable in those situations. And then with the owner's response to the dog for having inappropriate toileting behavior, for showing clinical signs of separation anxiety, the dog also had submissive urination, so fear-related urination. Now, post-treatment, so once we addressed the behavioral concerns and treated the behavior, this dog had no further episodes of hemorrhagic gastroenteritis. So it's important to realize that with noise aversions can present with underlying physical problems, health problems. And this dog went on to live 11 years of age and essentially was cured with medication and behavior modification. So what are some causes of noise aversions? Well, they may be affected by genetics or the signalment. There is one paper that suggests that herding dogs are predisposed. We know there are certain lines of working dogs, certain hunting dogs that are more susceptible to noise aversions than others. It may be early experience or learning, so potentially there was a traumatic event. A loud clap of thunder happened, lightning may have hit a tree, made it fall in the house, dog was outside and present and actually a tornado struck, so it could be some sound or traumatic event that induced the behavior. It's important to try to realize the type or the intensity of the stimuli and how that affects the behavior. It's not always the loudness that induces the noise aversion. Sometimes it's just the frequency or the tone. And interestingly, while dogs don't generalize very well, noise aversions are ones that are likely to generalize. So it may start with one sound and then other similar sounds induce fear, anxiety, or stress. The environment or the context in which the behavior happens is also important. That the animal may associate that fear, that anxiety and stress with the context or the environment in which it heard the noise. And then the presence or absence of conspecifics may influence the dog's behavior. There was one study that suggested the presence of other dogs had a beneficial effect in reducing fear, anxiety, and stress, but the presence of humans did not have a beneficial effect. Now, it also depends on how the other dogs react in that context. If the other dogs are calm, they're not anxious, well, dogs may social reference, and that may have a calming effect. If the other dogs are anxious in that situation, well, it may lead to anxiety and heighten the arousal response associated with a specific noise. For the study that looked at the role of musculoskeletal pain in noise sensitivities, and what they found was that noise sensitivities had a delayed onset, so 2 years in the control, as opposed to 6 years in those that had musculoskeletal pain, so a delayed onset. They found a similar behavioral responses to loud noise in both groups, and the most common clinical sign was shaking or trembling and or hiding. So number 2 and number 3 in that Zoetis study. Dogs with pain were more likely to generalize and show avoidance and with other associated environments and other dogs. And all those patients that were treated responded well, but the pain group, interestingly, only responded once the pain was treated. So this study really tells us that we need to treat the entire patient. If a dog has a noise aversion, we want to screen for underlying musculoskeletal pain, degenerative joint disease, and we want to treat the entire patient. Well, can we prevent noise aversions in dogs? Well, there's little known on the effect of early experience and how that can influence the dog's behavior. Possibly think about controlled exposure. So could we desensitize or counter condition puppies at our early age? We know their ears open at about 2 weeks. They can echolocate by 16 days. And the brain is fully developed by about 8 weeks. So could we expose them to different types of music at an early age? Thinking about bass, thinking about treble, different environmental sounds at a low volume that doesn't induce fear, anxiety, or stress, and also add some food treats or counter conditioning or play with the puppies during that time so that they can become acclimated, so that they have foundation memories, early exposure. Now, the mother's response may influence the behavior, and that dogs are observational learners, especially puppies. So they may look up to the mother and look up to the mother's behavioral response. If she's calm during a noise event, the puppies are likely to be calm. But if she was afraid or anxious, the puppies may social reference from her and be more likely to show fear, anxiety, or stress. So we try to expose them to music during the transitional period and beyond. There are Sound Good CDs put out by Terry Ryan. There are music apps that you can play off of a smartphone. And there's YouTube videos that are out there. So it is good to try to expose animals to a multitude of sounds at an early age so that they get used to those things and comfortable with those things later on in life. Well, can we prevent it? Well, maybe we select against dogs that have noise sensitivity. So if there's a genetic predisposition, we don't buy dogs from that breeder, potentially. We may avoid traumatic events. So don't take your dog to a Civil War reenactment. Don't take your dog to a firework display. Avoid those things. Those are real actual cases where, one single traumatic event induced noise sensitivity and it generalized to other things. And then we try to ask ourselves, well, can we prevent or lessen the exposure to the stimulus? So are there things we can do? It's not always fireworks. It's not always thunder. Sometimes it can be everyday household noises. So maybe it's the beeper sound on the alarm system to the house, and could we deactivate that so it's less likely to be exposed to it and become sensitized to it? A diagnosis of noise aversion is going to be pretty straightforward. It's the behavior regardless of the owner's presence or absence, and the owner's reaction to the behavior is important. Clinically, what I have found is that when owners are conditioning fear, anxiety, or stress-related behaviors, it can make it really difficult to treat. So we'll talk about that a little bit further. Some aids in establishing a diagnosis may be a videotape of the behavior during an actual noise event, possibly the reaction to noise recordings, although sometimes the animal may not respond to a noise recording and they do respond to the actual real thunder, that we can't replicate that 100%, but that may give us some indication. And we want to routinely screen owners because does your dog have a noise aversion? Owners usually aren't very forthcoming with that information. Oftentimes they may think maybe there's nothing we can do about it. Maybe there's nothing, or maybe it's a normal behavioral response. So we want to screen for that with each and every veterinary visit. And fortunately, Zoetis has a nice screening tool for you guys written by a board-certified veterinary behaviorist. So you can screen all your clients that come into your clinic for noise aversions. So there's a link there at the bottom for you guys too as well. What about the prognosis for noise aversions? Well, most cases have a fair to good prognosis with medication. It's going to be less favorable when there's common comorbid diagnoses. So if there's multiple anxiety-related disorders, it may be much more difficult to treat, like if there's a presence of separation anxiety too as well. The longer the duration of clinical signs, the longer the learning history, the longer the traumatic events, it may be more difficult for the animal to unlearn that fear or anxiety. And then owner reinforcement may also influence the animal's behavior. So how the owner responds to the dog in that context, if they aren't willing to change their behavior, it may influence the actual outcome. And then our treatment decisions are going to be affected by the geographical location. So it depends on what is the trigger that induces the anxiety. If it's storms and the sound of thunder, well, we can't control Mother Nature, so we may need to use continuous medication or continuous drug therapy. If it was something like the 4th of July, or New Year's, well, then we could likely use intermittent drug therapy. So it depends on if we can control exposure to the stimulus or not, to what medications we may think about using. So there is the question of whether we console or do not console when the dog is showing fear, anxiety, or stress. Well, there is a paper that was out that owner's behavior did not have an effect on the dog's physiological response or behavioral activity. So calming the dog didn't have a desirable effect with thunderstorm phobic dogs. Calming dogs didn't make the dogs worse either, though, too, as well. These were, as a small study, only 19 dogs exposed to a thunderstorm recording, and they found in both groups an increase in cortisol about 200% and fear-related behavior. So there was no effect of the owner's interaction with the dog in that context. But there are other papers out there that talk about social referencing and the dog's response to an object or an environment. Dogs will social reference. And that social reference had a stronger effect when there was a relationship with the dog. So if the dog was with its owner, who had had a positive social relationship, and that owner showed fear or anxiety associated with the object, the dog was more likely to show fear or anxiety associated with that object. So a positive or negative response by the owner or by a person, even a stranger, did affect the dog's behavioral response. A study by Karen Overall looked at separation anxiety and noise phobia and their common comorbid conditions. So in that study, they looked at the percentage probability of noise phobia given that the dog had separation anxiety, and it was quite high, 63%. The probability of the dog having thunderstorm phobia, given that the dog had separation anxiety, was also quite high, about 50%. Well, lo and behold, the probability of a dog having separation anxiety, given that the dog had noise phobia, was 88%, and the probability of separation anxiety, given the dog had thunderstorm phobia, was 86%. So noise aversions are commonly associated with separation anxiety. That's what we see clinically. So you have to ask yourself the question, consoling. There's kind of conflicting information on should you console, should you not console, and does that influence their behavior? Well, really, truthfully, consoling should not be the primary strategy for addressing the behavioral response, because we can condition operant responses associated with the behavior. So the dog hears a stimulus that induces fear, anxiety, or stress. The dog is taught to find the owner. The owner pets, consoles, loves, and dotes on the dog. So we're reinforcing attention-seeking behaviors or operant signs associated with anxiety. And then the dog may show anxiety in the owner's absence. So if the dog is taught to find the owner when it hears the sound of thunder and the owner isn't there, well, then the dog's going to go to the last place the owner was. The place where the owner's scent is the strongest, like the front door. And then they can clinically develop separation anxiety. The dog may also have anxiety in the owner's absence without storms, anticipating that a storm may happen when the owners are away. So that's the clinical progression that I typically see. So ideally, consoling is not a first option strategy. So now let me transfer it over to Debbie. She's going to talk to you about realistic goals for treatment.
Thank you, Dr. Martin. I think before we start talking about kind of the steps in treatment, which I'm going to talk about the first 5, and then Dr. Martin's going to come back and talk about drug desensitization, we really have to make sure we have realistic goals for treatment. If they're expecting that the dog could care less about any sounds in the future, they're probably not going to be as satisfied with the results of the treatment. Because oftentimes we can make really great improvement, that we have a dog that can now go outside during storms, isn't worried about that, can recover a lot faster, but it doesn't mean that they're going to completely forget or not worry at all about some of the sounds that have triggered fear, anxiety, and stress in them. So realistic expectations is that we keep their level of anxiety low, but it doesn't mean they could care less. So it's important to realize that. Ideally, we would love for them to care less. In fact, I've had actually pretty good success when we use a full treatment plan with some of my own dogs even, and a lot of our clients' dogs, that you wouldn't necessarily know that they had an issue because the treatment has gone so well. And that's our ultimate goal. But each client is a little bit different on how much they're going to want to do. So we're going to talk about kind of like the gold standard of if we could do everything, what it would look like. So there are basically 6 steps when we're thinking about treating noise aversions. We're thinking about 1, management and prevention, counter conditioning, response substitution, safe place training, and then systematic desensitization, and then drug desensitization. And we're going to talk about each one of those individually. So the first step is always going to be management and prevention. Can we avoid the triggers? For example, if it's whistles on TV, kid you not, one of my dogs, Iris, actually did not like the sound of whistles. It started with thunderstorms, progressed to fireworks, and all kinds of other sounds, but whistles became the most difficult one for her. Thankfully, we're not actually big sports fans, so it really didn't affect our ability to watch football or basketball or anything like that on TV. But certainly, if we had that playing in the background, Iris would notice and start to hide. So can we avoid or lessen exposure to the stimuli? Couple options would also be if things like other than sounds trigger it. So the flash of lightning from thunder, that's not a sound sensitivity, but it predicts sound. So can we close the blinds, use blackout shades? If you have storm shutters, when we lived in New Orleans, we had storm shutters, hurricane shutters is what we called them. So we could close those on our sliding back door, and it blocked out the flashes that preceded the thunder. Leaving a nightlight on can also be really helpful. In our own house, we have a dog currently that has some thunderstorm issues, and we will leave the bathroom light on so that they're less likely to see flashes from the windows, which actually triggers some of their initial anxiety even before they hear the sound. Playing background music or background noise. So through a dog's ear, species-specific music for the animal, a white noise machine would work, and a fan can work. Bathroom fans that are noisy are great. It's hard to find them anymore. Our current house right now and our master bathroom has a really great noisy fan, and it is our white noise machine with our own dog. So if we ever update our bathroom, I'm going to keep that fan in there because you can't find noisy bathroom fans anymore. Other management and prevention, we want to avoid drama. if we get worried or nervous, oftentimes they get worried and nervous. So we want to avoid this Scooby-Doo and Shaggy scenario. Iris, one of my dogs that used to have thunderstorm issues, she would look to me when she heard a clap of thunder, and oftentimes I would look to her to see if she heard it. And if I looked at her, she actually would start trembling. If I didn't look at her, I taught her to go to her safe place. She would go find her safe place instead. So want to avoid any drama. We certainly want to avoid any punishment for that behavior. And this is a hard one because, you know, even myself, like if one of my dogs is waking me up, seems like the storms always happen at like 2 a.m. in the morning, and they wake me up in the middle of the night. I'm thinking, oh, I only have 4 more hours of sleep. I really need to get sleep. Frustration can create anger in the pet owner. So we really want to avoid punishment because that's just going to exacerbate that fear and anxiety that the animal has about the storm. It may inhibit some of the behavior that the dog's showing in the moment, but it's going to create issues down the road and actually make it worse. So we want to try to provide them a safe place, like an interior room that doesn't see or hear as many of the sounds or stimuli associated with the sounds if we're talking about thunders and thunderstorms. The second part of treatment was using classical counter conditioning. So creating a positive emotional state instead of a negative one when the sound event is happening or the noise event is happening. So can we get the dog to play and engage in play or food or treats? Can we engage them in something that they enjoy doing? And some of you are probably thinking, Debbie, yeah, right. My dog, when they're in this state, they're not interested in playing. They're not interested in food. And you're absolutely right. They're probably at a FAS 4 and they're not going to respond to these things. But Dr. Martin's going to give you those tools when we're talking about drug desensitization to make this happen, because we know when we're looking at FAS 4, what do we need to do in the vet hospital? We need to treat it with medical intervention, and that's using medications to decrease that anxiety. But certainly using some kind of classical counter conditioning in the moment can sometimes be helpful, especially if it's a mild fear. But I want to be careful about this because this requires the owner to be present and help implement that coping strategy. So we're going to talk about other options too that don't involve the owner as much. Response substitution is what we use instead of punishment. When the dog is performing behavior we find undesirable, so they're panting or pacing or waking us up or digging at the carpet or scratching at something because of their fear and anxiety associated with the noise, we want to interrupt in a non-confrontational way. So it may just be calling their name, getting their attention, making a kissy sound. So we're going to, or clapping our hands gently, obviously not to the point that it frightens them. We don't want to startle them with another sound. We just want to get their attention and redirect them by cueing them a behavior that they already know. It could be go lay down, go to your bed, get up in the bed next to me and lay down, whatever you want it to be. We want to redirect them and then reinforce them for that new behavior that they've performed. Going right along with that is then, this is kind of the next step and really important part of treating a fear of noises and making it more independent from the owner. So creating a safe zone or a safe place training. There is a great handout that Zoetis has, and I'll have the link for that at the end of the presentation. I have some resources and some links for you there, but there is a handout called Create a Safe Zone, and it kind of goes step by step with this. But we want to create this safe place training. This is Iris's safe place. She actually was a pretty small dog, only about 17 pounds. And so we taught her to get into a kitty cube. This is one of those little cat cubes that you can buy at Walmart. And we trained her to go in there, and it blocked out the stimuli. And we put it in her favorite place to go, which is actually underneath my desk. So when she got nervous hearing thunder, she would go back behind my desk and start digging around and trying to hide back there. So we trained her into her cube. She would go to her cube and get treats for that. So then we taught her to transfer that to when she heard the sounds. And we're going to go through the process of how we do that. So the first step is actually teaching them to go to a mat. So we create a positive association with a mobile station. We're going to utilize as many senses as possible, just like we do in fear-free vet exams and vet visits. We're going to use things like adaptal or aromatherapy, and also use calming music or sensory perception for them. In the initial stages of station training, it's only going to be out during the training sessions. It's not something that stays out all the time until we've trained it. You're going to start the training in a location that the dog is relaxed and comfortable, and on days that the dog is relaxed and comfortable. If they're already anxious or nervous, we don't want to associate that with actually this training. And once we have a predictable behavior that they're going and getting on their mat, we're going to add a cue to that and generalize it to a variety of different places in the house. I'm going to show a video that demonstrates this. And when we show videos through the webinars, there's no sound on the video. So I'm going to narrate what's being said in this video. At the end of this presentation, I think Christy's also going to share the link within the presentation. There is a link to the full video that shows this whole process with narration, but I'll narrate through as we are watching the video. So this is the first step in safe place training. The first step in creating a safe place for desensitization and counter conditioning to sounds such as thunder is to create a positive association with a mobile station. Engage as many of your dog's senses as possible by using calming pheromones such as adaptal or aromatherapy and species-specific calming music. In the initial stages of training, the safe place station will only be out during training sessions. Choose something that is mobile, such as a bath mat or towel. Training should be started in a location the dog is calm and relaxed, and when the frightening sounds are not likely to occur. For thunder, that means only on good weather days. To create a positive association with the station, you can train known behaviors on the station, but since the goal is eventually for this behavior to be an independent, self-soothing behavior that does not involve you, the majority of the time on the safe place should involve independent activities such as eating a meal out of a snuffle mat or special treats out of a food puzzle. Once the behavior is predictable, add a cue such as go hide. So here she went off to get her treat. I'm going to cue go hide. She gets onto her station, does it down. I reinforce that. Generalize the station to a variety of places in the house and even outside. So that's the first step in treating it. We're teaching them to go to their safe place. They're getting a positive association with it. You need to do that for a minimum of 3 days. And I say a minimum, I mean 3 days is going to be the minimum for a dog that already understood, like going to a place or going to a bed. They've learned that before, and we're just teaching them a new place to go to that's a little bit different. But if they have no learning history with that previously, I would say this could take a couple weeks. We really want them pretty happy about it before we move on. Prior to adding in the desensitization part, we want to test the noise recording that we're going to use, because we're going to actually start implementing noise recording with going to their safe place. So we want to test that recording on a neutral location without the safe place there, just to assess the response. Just in case the dog becomes nervous, I don't want to associate it with their safe place in this early training. And then we add in the safe place training once we're sure the dog's comfortable with it. So this video is going to demonstrate that. Once your dog is excited about his safe place, the behavior is on cue, and you have generalized it to several locations, you will now be ready to start adding in the desensitization to sounds. This example will be with thunder. Before playing the sound with the safe place training, first test your dog's reaction to the recording without the safe place setup. We want to make sure we have a non-stressful starting point. Play the recording on a low volume with your dog relaxing nearby. As long as your dog does not appear to become nervous about the sound, we are now ready to start using the safe place training with the sound recording. Now Jazz looks a little bit nervous sitting here next to me. She's kind of thinking, what are we doing? This is not our typical couch. But she's not showing any change in her behavior when she's hearing the sound of thunder that's coming out of my phone right there. So that was important to realize. And it was being played on a very low volume. Once we've tested it, now we're ready to start incorporating it into the safe place training. We're going to do this in a place that you've trained before, but not the final location you want to use, just in case they get nervous again. So we'll be playing the recording at a volume that doesn't induce fear, anxiety, or stress, and gradually increasing the volume throughout the training session without inducing fear and anxiety, and always begin at the lowest volume when you start a new session over again. Don't start where you stopped before. You want to start low and build up each time. So here's a video showing that. Start in a location where you previously have worked on safe place training, but it should not be the final safe place location. Always start each new session with the sound on a low volume. Bring out the station and let your dog relax and eat treats on it while the volume of the recording is slowly increased. Pay careful attention to your dog's responses. The goal is for the dog to show is to not show any anxiety with the sound. As you can see in this video, the volume is increased too quickly. You're going to see her pause right here, and this is not on slow-mo. That was actually her hearing thunder. As you can see, the volume is increased too quickly. When the dog slowed down eating, the volume should have immediately been decreased. If your dog starts to slow down or stop eating, you know the stimulus is too much. And what I actually did there was what you should not do. I had increased the volume because I kind of saw her do that lick, and I thought, did she just notice that? And I increased the volume a little bit more, and you saw that she stopped eating altogether. So you want to slow down, you want to take some steps back, decrease the volume, and maybe even end the session altogether if you need to. So we want to generalize that training to multiple locations in the home, just as we did with teaching the mat. And then we're going to transition to the desired safe place location. So now we have to train it in the ultimate place we want them to go to. It might be in a bathroom, some kind of interior room, in the closet, something like that, that is less likely to have some of the stimuli associated with whatever noise event it is, whether it's fireworks, gunshots, thunder. Then once you're able to play it at a high volume without any fear or anxiety and the dog's going to its station, now the station can stay out all the time so they can seek it out when they're nervous or anxious. And the last step of this, which I think is probably one of the most important ones to build independence, is where we transfer the cue. We actually teach them that the sound, the noise, is the cue to go to their safe place. So I'm going to show you a video with that. Eventually working up to the final safe place location, your dog may have already chosen a place he or she prefers, such as a bathroom or closet. Once you're able to play the recording at a high volume and your dog is relaxed in eating, the station can remain out in the environment at all times. The final step is teaching your dog that the sound is the cue to go to her safe place. Have your dog resting nearby you, warm her up by cueing her to go to her safe place and reinforce her. Then with her resting nearby, play the sound recording. So here I'm going to turn on the sound. There's going to be a clap of thunder. I tell her go hide. She goes there and I reinforce. After a few repetitions, pause after the sound happens and see if she chooses to go to her safe place. So you're going to watch here. She's sitting next to me. I turn on the recording. There's just rain playing right now. No thunder yet. No thunder. It's about right here. There's a clap of thunder. She orients towards it. I wait. Jess chooses to go to her safe place and I reinforce. Now the sound has become the cue for her to go to her safe place, giving her a coping strategy to help her handle her fear on her own. So that's going to be the important last step so that the dog has a place that they can seek out on their own when they're nervous or anxious about something and they've been reinforced for it. I'm going to turn it over to Dr. Martin for talking about drug desensitization.
So medication is going to be a very important component to treating noise aversions in dogs. And your medication treatment decisions are going to depend on if we can have the medication in the dog every time the dog is exposed to that noise-induced event that triggers fear, anxiety, or stress. Ideally, we want medication on board every time so that when the dog hears that noise, it's not afraid, it's not anxious, it's not stressed, and therefore it can learn to overcome that fear-based reaction. If we're using a situational anxiety medicine and we miss a dose of medication and the dog hears that noise and experiences fear, anxiety, and stress, that is the long-lasting memory. That's what he remembers. So he's less likely to become desensitized to the stimulus and more likely to become sensitized to it in that context. So drug desensitization is where we use a medication when we cannot avoid the full strength stimulus, whether it be thunderstorms pass through, or there are household sounds, noises, such as the beeping of the microwave, maybe the beeping of the door as you open and close it, the squeaking of the door. It could be other household sounds like the ice machine when the ice drops that induces fear, anxiety, and stress. If we can't avoid it, we need to use drug desensitization. So our goal is that we use drugs to prevent or minimize the fearful reaction and allow learning. Again, allowing the animal to learn to overcome that fear, anxiety. And after we've had progress, we're going to gradually reduce the drug level over time, and the animal becomes more aware of the stimuli. So the animal then can become desensitized as we wean them off the drug. Now, when I'm using the technical term is drug desensitization, but when I'm explaining it to clients, I don't use the word drug. I always use the word medication, because the word drug has a negative connotation. And truthfully, some owners don't want to put their animal on a drug. So we say medication because medications have medicinal value. They have some benefits, and it's a more PC term that's better accepted. So when we cannot avoid the full strength stimulus, when we cannot avoid things that happen with Mother Nature, we think about drug desensitization. And there's two medications that are mainstay medications or daily medication that we typically use day in and day out when treating patients that have noise aversions when we can't avoid them. One may be an SSRI like Reconcile or the generic fluoxetine, and the other may be a tricyclic antidepressant like Clomicalm or the generic clomipramine. Both of those medications are only FDA approved for separation anxiety in dogs. All other use would be extra label. But the goal would be to have an anti-anxiety medication on board every time, so when the dog is exposed to that noise, it doesn't induce fear, anxiety, or stress. We use this for treating chronic fears, phobias, and anxiety-related conditions. Now, there are times where there's situational anxiety, or the animal needs a little push. It needs something to help it to get over the edge with exposure to the noise. And we only have two medications that are FDA approved for treating noise aversions in dogs. And currently we only have one that's available in the United States, and that's Sileo. Sileo is dexmedetomidine oral mucosal gel. It has a rapid onset of action within 30 to 60 minutes, and it promotes rapid calming without sedation. It's really nice that it's short acting, and it's very, very effective. I use Sileo a lot in my own dogs, and it really can be a lifesaver for a lot of dogs out there. Now, Pexion, although it's been FDA approved, it is an anticonvulsant, a partial benzodiazepine, but it is not available in the United States yet. I'm waiting for it to be available. I haven't tried Pexion. The unfortunate thing is that with Pexion, you have to give it several days prior to the noise event. Not so with Sileo. Sileo is rapidly effective. So for acute noise, fears, anxieties, or phobias, these are our FDA-approved medicines, and these are going to be our first choices. Let's go over some important safety information with Sileo. Sileo should not be used in dogs that have severe cardiorespiratory, liver, kidney disease, or otherwise compromised or debilitated. Any dog that's hypersensitive to dexmedetomidine or any other excipients, you should avoid it in those patients. It hasn't been evaluated in dogs younger than 16 weeks of age. With dental or gingival disease, that may affect absorption. That has not been tested. And it has not been tested with aversion behaviors to thunderstorms. So currently, right now, it's only noise aversions. Sounds hasn't been tested with thunderstorms and other factors, because thunderstorm phobia is not just a noise phobia. There are other things that predict the noises. It has not been tested in breeding, pregnant, or lactating animals, so use caution there. Adverse reactions most commonly that are seen are pale mucous membranes at the site of application. Uncommonly, you may see emesis or vomiting, drowsiness, or sedation. And usually I'm more likely to see sedation. It's dose related, or if we're repeating doses, you might see a little bit of sedation, or if the animal is more sensitive to it. But most side effects are mild, and it seems to be very, very well tolerated in most canine patients. Now, it is recommended to handle the gel dosing syringe with caution. You want to avoid a direct contact with the skin, eyes, or mouth. Instructions are you want to tell clients how to use the syringe, how to administer administer the medication to their dog. Whenever I prescribe Sileo, I send my clients a Sileo administration video. You can Google that video. It pops right up on YouTube. And so it shows safe handling of the syringe, how it's administered. It is recommended to use gloves with administering Sileo. So it gives them all that information. But I also have my clients practice with a dummy syringe. So this is just a syringe that I use for my dog that I have cleaned, and I have them practice locking in the dosage, adjusting the proper dosage. And typically we'll have clients practice with the syringe. We'll send them home with one, and we'll have them practice with administering some beef broth or canned cheese like Cheese Whiz, so that the dog sees the syringe and thinks, oh, a yummy treat's coming out of it. And that helps to reduce fear, anxiety, and stress. So you want to handle the syringe with caution, make sure it's locked in properly before administering it. There are other times where we consider using drug desensitization or situational anxiety medicines other than Sileo, or there are some times where we use Sileo in combination with the mainstay medication or other adjuncts. Caution in that it may have added sedative effects when we do that. Other options may be benzodiazepines, so a GABA agonist. We could consider using trazodone, a serotonin reuptake inhibitor, serotonin antagonist. We could consider using gabapentin, a medicine that blocks glutamate, which is a major excitatory neurotransmitter in the brain. Or we could consider using another alpha-2 agonist like clonidine. So essentially the way an alpha-2 agonist works, or Sileo works, is it blocks norepinephrine in the brain at the locus coeruleus, which is a fear center of the brain. So it prevents that acute arousal response. Sileo is available as an oral mucosal gel, so it has to be applied to the gum line. Clonidine is an alpha-2 agonist it's available in a tablet form. But clonidine isn't as specific for those alpha-2 receptors as clonidine. And Sileo is also much more rapid acting and shorter acting. So it's something that's really nice about it. You may consider other nutraceuticals, but these are going to be mild cases of noise aversion. So most of the cases that are presented to me, they're beyond where nutraceuticals are going to be a benefit. But they may be a layering strategy where we use these in combination. L-theanine is an extract that's found in green tea that's thought to be a GABA agonist, so angiotensin. There is some evidence that L-theanine may be helpful in treating noise aversions, noise sensitivities in dogs. We could consider using alpha-casosipin. That's a peptide that's found in milk that's thought to be a GABA agonist, so something like found in Zilkine that may reduce fear and anxiety in dogs too as well. And then we can consider using a combination product, so Soliquin. It has L-theanine, extracts of Magnolia officinalis and philodendron, and it has dried whey protein concentrate. So it's a combination product. And Soliquin was tested for noise aversions in dogs in a trial for dogs that were sensitive to the sounds of thunderstorm recordings. Other alternative therapies we may think about. Well, in some cases, we think about using a thunder cap. Sometimes there are other stimuli associated with thunderstorms. It's not just noises. Maybe there's visualization, and the visualization of the wind blowing then predicts the sound of thunder. So there's all these other things that happen associated with the sound. And so if the animal can't see that, sometimes they're less anxious, they're less aroused. Debbie already talked about like leaving a night light on, those kind of things, have some other sound recordings playing in the house. That may help too as well. So a thunder cap's one option. And an anti-anxiety body wrap, so like a thunder shirt or a storm defender cape. There is some evidence that a thunder shirt may help to reduce fear, anxiety, and stress, ambulatory behavior in dogs exposed to the sound of thunder. A storm defender cape, so it's been suspected that static electric charge induces anxiety in dogs, and there is some research that a storm defender cape may be beneficial. Or Adaptil. Adaptil is a pheromone that's secreted by the lactating female dog that's been shown to have calming properties. And so we have some evidence, and the papers are below listed for you guys. Now I'm going to transfer it over to Debbie. She's going to talk to you about a case example.
In this case is my own dog, Jasmine. She had an aversion to thunder. It developed at about 4 years of age. And interestingly enough, her dad, Polo, who we also own, he has sound sensitivities and is worried about thunder. So it could be genetic, like we learned. But also what was interesting with Jazz is that she's very sensitive to the other dogs and what their behavior is. So if they bark at something, she gets nervous and will come over by me. And so what happened initially was thunder would happen, and then Polo would get nervous, and Jazz started getting nervous. So then she would hear the thunder, and before Polo got nervous, because now Polo's almost 14 and he can't hear the thunder as well, she gets nervous. So she has learned, I believe, somewhat from him. The reason I think this is because when Jazz and I used to do rally and agility trials, sometimes we had to travel by ourselves and stay at hotels or at friends' houses. And when we had thunderstorms come through when we were out of town, she actually didn't react to them. She slept right through them. So some of it was the context of being at home, the other dogs being nervous. So the one study Dr. Martin talked about, it implied that being around other dogs actually decreased their anxiety, but maybe in Jazz's case, it increased her anxiety. However, she has generalized to other sounds as well, such as fireworks and gunshots. She is being treated, interestingly enough, for musculoskeletal pain. She has some arthritis. She's almost 11 now. But at 4, she may have had some mild things, but nothing very significant. So what kind of treatments have we done with her? Well, we tried to minimize exposure. Talked about putting the fan on in our bathroom, having the light on, and we try to do that on nights too when we don't have storms, or during the days when we don't have storms, so that she doesn't predict, hey, the light's going on in the bathroom and staying on, or the fan's on. It must mean there's going to be a storm tonight. Safe place training. So we taught her the go hide cue, and we set that up into the bathroom because we don't actually have any windows in our master bathroom. We have her on daily fluoxetine at 2 mg per kg for her generalized anxiety disorder. And if we can anticipate noise aversion, so we check on our phones all the time. We have the weather app on there so we can check to see if storms are coming nearby. We try to keep up on the weather. If we can anticipate, generally we're going to give her gabapentin 20 milligrams per kilogram and trazodone 5 mg per kg in anticipation of the noise aversion. It's usually about 2 hours beforehand. If we haven't anticipated and something rolls through in the middle of the night, which can happen quite often because I'm not always good at checking the weather, then we will give her Sileo 3 dots oral transmucosally, kind of as needed. And that can be repeated every couple hours, every 2 hours, I think, as long as they're not sedate from the other dose. But oftentimes I find that she falls to sleep pretty quickly after getting that, and I don't need to redose her. Usually the storms don't last that much longer. So things have worked out well there, and it's helped save me and give me some more sleep as well. So when we're talking about noise aversions, we realize from Dr. Martin, all the evidence that he showed us, that it's a very prevalent issue. It's quite common out there. Dogs are afraid of noises. They have an aversion to them, and quite often that's affecting their welfare and their well-being. So it is the issue of their welfare. We want to make sure we're screening routinely because owners aren't always forthcoming with it. So you can use the Zoetis handout, the little checkbox one, or you can get into the habit of asking about storms and fireworks and any noises that might create some aversion in the dog. We want to try to take preventative measures. Although we don't necessarily have evidence that prevention is affecting it, I feel like some prevention is always good. Just like preventative medicine, if we're acclimating them to these things and taking preventative measures, we're less likely to see it develop because we're being proactive about it. And it's a very multifaceted treatment option. There are lots of components to treatment, and oftentimes that can be the hard part with owners and even for ourselves. Like, we do this for a living, but sometimes it's hard to remember to do it with my own dog, to do the training and put the training in. But if we put all those parts together, we're more likely to have a dog that can overcome their fear of noise and actually live have a good well-being and a great welfare even when noise events are occurring. Here's some great resources for you. Well, you can email us anytime at info@veterinarybehavior.com if you have questions about this, but the other great resources are sileodvmus.com. That's where you can find this Create a Safe Zone treatment handout, as well as a checklist for assessing if a dog has noise aversion. Fear Free Happy Homes has some great little short videos. They're animated videos on noise aversions and fear of storms. So that's another great resource for your clients as well as for you and your own pets. And then here's the link, the Vimeo link to that thunderstorm and safe place training video. The whole entire video shows the entire process that we watched earlier today. And I want to thank Zoetis for sponsoring this webinar. I think we can open it up to questions now.
Fantastic. Thank you so much, Dr. Martin and Debbie Martin. It was wonderful. Could I ask you to go back to that slide? Yes, that one, and leave that up so people will have the chance to make a note of those resources. They're all fantastic. I would like to start out with a question that was about what it means to be able to reinforce an emotional response. I think most of us have heard the caution that you can't, the comforting your pet when they're frightened doesn't make them more, doesn't reinforce them for being afraid, but that's really kind of different from what you were talking about. Dr. Martin, could you explain a little bit more on that subject?
Sure. So it's widely accepted that you can reinforce calm behavior or relaxed behavior in dogs, and it's a little controversial whether a change in your behavior may make a dog more anxious, more afraid. Can you condition fear behavior with attention in dogs? That's maybe a little bit controversial out there. What we do see is that you can easily reinforce attention-seeking behavior. So if the animal comes over and it paws at you, it's anxious, and you pet the dog, you love on the dog, you can console the dog, you're reinforcing attention-seeking behavior or teaching the dog an operant strategy of the coping mechanism when you hear this noise event is to find your owner and they will save you. Where that can be problematic, and it would be fine if you could always be home with your dog, but the problem is there are times where you have to leave the dog home alone and it may be exposed to that noise event. And then it tries to find you, and then that dog can develop separation anxiety. The other thing is that change in your behavior, while dogs are better hearing that noise aversion in the presence of the owner rather than in the absence of the owner, it may calm the dog in that moment. It doesn't actually change the dog's emotional response necessarily to that stimulus. So, and then adding any drama to the situation, dogs may social reference. We do have some evidence that they will social reference. And so if you act anxious or afraid, then the dog is going to be anxious or afraid. That change in behavior by you may justify, oh, I should be worried about something. Look, you're acting all different. So that could justify the fear reaction. So while we may not be conditioning an emotional response with consoling or petting or loving the dog, we certainly can condition an operant response associated with the behavior. And truthfully, when we're working with relaxation protocols, we are conditioning operant responses associated with relaxation. Here we're conditioning operant responses, not reinforcing behaviors, operant responses that are associated with fear, anxiety, or stress in dogs. So the changing doesn't, it's not necessarily going to change the behavior for the better. So it should not be our primary option strategy in that context.
And I'm going to jump in and add some to that as well. So we're not saying that you can't give your dog attention. I think that's really important to realize, is that you can interact with your dog. We just want to make sure that the attention is something that is calm and relaxing, right? Like, it's not like, it's okay, buddy, because the only time we ever say that is when in the dog's mind, it's not okay. And like Dr. Martin was saying, this is about the behaviors associated with the emotion, and so versus the emotion itself. So you're not reinforcing fear, but you can be reinforcing the operant, the behavior you're seeing, right? The dog seeking you out. So I think there's a big difference between that. And certainly, yes, if the dog is more comfortable being near you in your home, let the dog be near you. But if that's the only coping strategy the dog has, you're not going to be decreasing their fear of that noise in the long run by doing that. You're just putting a Band-Aid on it as opposed to actually treating it. Hopefully that makes sense.
Oh, it's great. Thank you, because we did have multiple questions about that. So I'm glad that you were able to go into more detail. The next question is that how do you manage safe place training at home when you have multiple dogs, especially if only one of them struggles with noise aversion?
Yeah, so whenever you have multiple dogs, training in general can be challenging. So my first go-to is if I'm teaching my dog something new, I want to do that in a non-distracting environment. So that tends to mean not having the other dogs or animals around, maybe even not having other people around, not having the TV on. I don't want to be distracted either, so I can give my dog my entire focus. So creating an environment away from those distractions to teach something new. So you saw with Jasmine in the training that I was doing, we have multiple dogs, obviously. So I trained it by herself, and then I added her into the mix of the other dogs and being able to respond. For example, if I was going to learn calculus, I would want to do it in a room where the TV wasn't on, the radio wasn't playing, nobody was talking to me, there's not a lot of activity. I can really focus and learn. And then once I get good at calculus, I maybe can turn the radio on and have it playing in the background, or have the TV playing and I can tune that out and actually focus on calculus. Maybe I get so good at it, I can do it at a restaurant, or while I'm at a concert or a sporting event. I'm out in public. So certainly the distraction level can get better the more fluent I get with the behavior. And that's the same with training something for a dog. So we want to give them a non-distracting environment initially. So a couple options is managing the other dogs in another room, giving them something else to do, or the other animals, cats too, can sabotage your training as well, because they might want to get in on the training and get the treats, which could make the dog that you're trying to train very distracted or worried that the other animal is going to get their treat. So you can manage them away visually in a different area so they're separated. Another option is actually teaching the other animals to station. So they all line up on the couch, and while you're training the other dog down on the ground on their safe place, you're periodically giving treats to the dogs or cat that are stationed up on the couch. So they're getting reinforced just for doing their stationing behavior while you're kind of teaching the other dog the tricks.
That's great, and I'm glad you mentioned cats, because our next question is, do you have any suggestions for noise aversion in cats?
So noise aversion in cats isn't really well studied. Maybe noise aversions do occur in cats. I mean, but I guess people think that it may be normal that cats, run and hide, right? So they're not jumping on you, climbing on you, waking you up, dancing on your head like a dog. And in the middle of the night, the cat may be hiding underneath the bed. And so they're possibly are less aware. The owners are less aware that the problem is out there. So Sileo is not FDA approved for use in cats. I've never used Sileo in cats. Of course, dexmedetomidine has been used in cats, injectable. So maybe we'll have some evidence or research in the future. Typically what we're going to think about in most cats, if I had a cat that had noise aversion, I may think about using gabapentin, or I may think about using a benzodiazepine. And the most common benzodiazepine that I would use would probably be lorazepam in cats. So those would be ones that we could consider. You also could consider using a nutraceutical like Zilkene. Zilkene may be beneficial. Zilkene may help those patients, and it's extremely palatable. So it makes it easy to administer. Sometimes that can be a challenge with cats, getting to take a medication.
That's great. I have a friend whose cat just licks up the Zilkene powder off of a plain dish. I mean, they love it. So I'm glad you mentioned that, because that causes a lot of fear and anxiety and stress in cat owners when they're told to give their cat something orally. So something else that we've received several questions on relates to crates. Can a crate be a safe place? What tips do you have on that? And how does it affect your choice of the crate as a safe place when the crate is also somewhere that you leave the dog when you're not there?
The crate can be a safe place. You saw in the video that actually did show a crate with a blanket over it, kind of decreasing some of visual stimuli and maybe insulating it a little bit. If you're going to use it as a safe place, you want to make sure that it can be kind of in an interior room where it's less likely to hear sound events that would be happening outside or potentially in the main part of the house. You also, ideally, when I'm using a crate for a safe place, I like the safe place to be optional, so that the dog has a choice to go in there versus being in there already. It really depends. I obviously don't have a great answer for this because it kind of just depends on the individual animal. If the dog loves the crate and is happy to be in there and feels most comfortable there, it could be used when you're not there. I think that what I think is most important is that you're able to get video footage to know what the dog looks like in the crate when there is a storm already, so that you're not trying to teach them to be completely relaxed when they're thinking they need to get out of that crate and they already have a negative association with the crate and storms or noises. You're going to have a much more difficult time convincing them that that can be their safe place. But if that tends to be their most comfortable place, then I think that it could be a great choice. Let's just make sure that the placement of it is in a good place that will minimize the noises that would be associated with the adverse event.
Great. What is your anxiolytic combination of choice for a dog for whom Sileo is contraindicated due to a health condition?
So if I couldn't use an alpha-2 agonist, I wouldn't use clonidine, since it's very similar to Sileo as another alpha-2 agonist. So there are multiple medications that we may consider. Gabapentin seems to be very effective in treating noise aversions. Trazodone seems to be effective in some patients, although any anti-anxiety medicine has the potential to cause a paradoxical anxiety effect. So we want to test these medications in the absence of stress factors to make sure that it has a desirable effect in that patient. And then benzodiazepines can be really effective in that, especially the ultra short-acting benzodiazepines like alprazolam can be very effective. So those are the most common ones that I'm going to consider using if I had a patient that alpha-2 agonist was contraindicated. And those medicines are usually very heart safe.
And as a sort of follow-up, what is your go-to combination for dogs who have a really severe noise phobia?
So with severe noise phobias, again, it depends on if it's situational or it's going to depend on if it's something that's day in and day out that cannot be avoided. Typically, I like Sileo. I use Sileo a lot now that it is the only FDA-approved product. So that's going to be my first one to go to when there's not a contraindication for using Sileo. But typically I'm going to have the patient on a mainstay medication. So there was a study that looked at clomipramine combined with alprazolam used to treat thunderstorm phobia in dogs. An older study, this was before Sileo was out, and they found that it was 95% effective. Most of the dogs did really, really well on it. So that was quite surprising. But we have used other SSRIs too as well. And some patients respond better to one than to the other. So usually I will use a mainstay medicine and then a situational medicine or an adjunct. And Sileo is going to be one I always try first. The only downside, I think, would be that it's not cost effective to use day in and day out. And in large dogs, well, there's only 12 dots in a tube. They're going to go through that pretty quickly. So that may be a cost factor for day in and day out use. But Sileo is extremely effective. It's a really nice medication and it works really, really well. And I rarely ever see paradoxical excitation with Sileo. I have not seen it as of yet.
Okay, great. Because that is very troubling to see for pet owners. Debbie, a big question that people had when you were talking about Sileo was, how do you get a dog to take the Sileo and not swallow? And how long until they can eat or drink after you've given the Sileo? And how long do you have to prevent them? Do you have to prevent them from swallowing? In other words, if you're preventing your dog from swallowing the Sileo, trying to keep it in contact with their gums, how long do you have to keep them like that?
Yeah, this could be the challenge. Application can sometimes be the challenge. We don't want them to swallow it. So first thing, I think it's important for the owners to practice without the animal being nervous, right? So Dr. Martin was talking about how we send the clients home with an old syringe and we have them practice with fluid of some sort so they can become comfortable with the placement of it. I will sometimes find that, especially with dogs that have small mouths or a tight mouth, they don't have like a big cheek pouch, that it's actually easier to apply it to the top gums. So I just lift the upper lip up in the back there and I apply the gel along the top of the gums. And then I just hold the muzzle shut and kind of rub against that area for about 20 to 30 seconds. To allow that to absorb. And because it's in the side there, they may lick a little bit of it, but then it tends to get stuck on the roof of the mouth as well. And so they're not just swallowing it. It's so important to really show them what that looks like, because most owners want to take the syringe and put it right in the middle of the mouth and shoot it into the mouth or to the roof of the mouth. And if they swallow it, it's not going to be very effective. And that's usually when Dr. Martin has clients say, hey, it didn't work for them because most likely it didn't get applied to the gum line. As far as on label, Sileo says to wait 15 minutes before feeding or giving any food. My own personal dog, I have, she's a little hesitant about the syringe, so I actually put like a pill pocket on the outside of it just to make it softer. And I put the gel in and I massage it there. And then I'm actually able to distract her with eating the pill pocket, little pieces of it. And she's not thinking about the gel that's sitting there. So I think it actually stays there longer because she's not trying to wipe it out with her tongue because I distract her with some treats. Technically, that might make it less effective, possibly, maybe making her hypersalivate more. I haven't actually seen a decrease in that, but again, that's not what's recommended in the administration part of Sileo, but they're saying 15 minutes before feeding or giving treats.
And are you supposed to restrict them before you administer it as well, or just after?
Just after. I didn't see anything, I don't see anything on label that says beforehand.
Okay, good.
Okay.
All right, great. So we have a question here about, is it safe to repeat the Sileo if the behavior continues after the initial dose has worn off? If so, how soon can it be repeated?
Sure. So the recommendation on label is to apply Sileo into the cheek pouch 30 to 60 minutes prior to the noise aversion. So it's going to work a lot better and be much more effective if it's given prior to the actual noise event where those neurotransmitters are already firing and the dog's already panicked or anxious. And it can be redosed every 2 hours up to 5 times within a 24-hour period or event. So you can redose it. Clinically, what I've seen when it is reduced sometimes or redosed, sometimes I will see I'm more likely to see a sedation effect, but that would be okay if the dog woke you up in the middle of the night. In my own personal experience with using it with my own dog, I have seen her respond in about 15 minutes and where she's panting and pacing and standing on the bed and inability to settle. She'll let out a nice big sigh, can lie down, put her head down. And so I've seen a much more rapid effect in her, my own personal pet.
And then I'm going to get now to our last question, and it is a really interesting one. You alluded to it a little bit in the presentation, but someone's asking, wasn't there research done with thunderstorm sounds that could not reproduce the same reactions that you would see to a true thunderstorm, leading researchers to suspect there might be some sort of electrostatic stimulation that is missing in the reproduction of the sound, but present in a true storm?
I'll take this one because I'll geek out on the science of it. I get really excited when I get to think about these things. So what's happening is it's all classical conditioning and there's pairing that's going on. And we call this higher order conditioning. The same thing happens for a dog that, let's say a dog who goes to a fear-free vet hospital and loves going there. So they know when the owner turns right instead of left, that means we're headed to the vet hospital. And so they start to get, then maybe they start hypersalivating because they know they're going to get lots of treats and they're really excited and they can't wait to get there. And then, oh, lo and behold, you pull into the parking lot, they were right. So there are things that will predict future behavior and dogs will learn those predictions. And what can happen with storms is they actually learn that, hey, when it gets windy or cloudy or it starts to sprinkle, there's a possibility there could be thunder. And so those stimuli start to elicit the same behavior, even though the thunder is not there anymore because they've become associated with that scary stimulus, the thunder. So dogs will start to anticipate barometric pressure changes. All these things could be affecting their behavior and eliciting the same thing as if the thunder has already occurred. So when you think of Pavlov's dogs, right? The bell predicted the food. So then dogs started to salivate when they heard the bell because they thought bell means food. Same thing happens with all the different things that precede a thunderstorm or thunder itself. What's kind of cool about that is they can learn a variety of different things. One of my own dogs, Snickers, I got him back in 1992, and he is the reason I am in behavior. But he had some thunderstorm issues as he got older, and it was interesting. He actually would start to get nervous when I turned on the weather channel, because that tone, well, I would check the weather channel when I thought weather was going to be bad, and he started to learn the jingle meant the weather was going to get bad regardless of what it looked like outside. So he actually paired that together. Isn't that amazing? What a smart dog. Wow. I'm like, hey, he's getting nervous already. Yeah, quite interesting. And then I was going to circle back to that, and I forgot what I was going to say. Dr. Martin, what was I going to say? You don't know.
Well, when you said that they're starting to associate, the non-thunder, the non-noise.
Yes. Oh, yes. Yes, I know where I was going to say, because there was a question of, research showed that maybe the recording of thunder isn't the same thing, right? And we also used to say, if they weren't nervous of the recording of thunder, you can't desensitize them to it. And I agree with that. You can't desensitize them to it, because there's nothing to desensitize. If they're not afraid of the thunder on the recorder, you're not desensitizing. But when I'm doing the safe place training, my goal, and I actually love it when they're not afraid of the recording because it's much easier. My goal is to teach them, hey, sounds that sound like this or noises that sound like this are your cue to go to your safe place. So it's even easier if they're not actually afraid of that recording. They can still learn, hey, when I hear these kind of sounds, go to my safe place and it'll be good.
It's fantastic. I love this tip, and I'm going to make use of it with my thunderstorm fearful dog. Well, as I said, this is all we have time for. I want to thank you both so much for doing this presentation. And of course, I want to thank Zoetis for making it possible. We're very grateful. We hope that you and everyone who was here tonight has a wonderful evening, and we will see you next time.